Welcome to our channel. Today we're tackling a common medical issue that can be pretty scary when it happens: nosebleeds. Whether you're prone to them or just had your first one, knowing how to react quickly and effectively can make all the difference. We'll walk you through proven techniques to stop a nosebleed fast, and when it's time to call in the professionals. Alright, let's imagine this. Your nose starts bleeding. It can be a startling and uncomfortable experience, but it's important to stay calm and composed. First things first, don't panic. Panicking can increase your heart rate and blood pressure, which might make the bleeding worse. Instead, take a moment to collect yourself. Take a deep breath and remember what you're about to learn. This knowledge will empower you to handle the situation effectively and with confidence. The most important step is applying direct pressure. This helps to stop the bleeding by compressing the blood vessels in your nose. Use your thumb and index finger to pinch the soft, fleshy part of your nose, just below the bony bridge. This is the area where most nosebleeds occur, and applying pressure here can help to stem the flow of blood. This is where most nosebleeds originate. Understanding the anatomy of your nose can help you apply pressure more effectively. Think of it like you're trying to gently hold a potato chip between your fingers, firm enough to hold it, but not so hard that you crush it. This analogy can help you gauge the right amount of pressure to apply. Now here's the key. Maintain that pressure for a solid 10 to 15 minutes. It might feel like an eternity, but this duration is crucial for allowing a clot to form and stop the bleeding. I know it seems like a long time, but trust me, it makes a world of difference. Patience is essential in this process. Resist the urge to peak or release the pressure to check if it's stopped. Every time you do that, you could dislodge the clot that's trying to form and prolong the bleeding. Every time you do that, you could dislodge the clot that's trying to form and prolong the bleeding. It's important to trust the process and give your body the time it needs to heal. Another important tip is to sit upright and lean slightly forward. This position helps to reduce the blood pressure in the veins of your nose and prevents you from swallowing blood, which can irritate your stomach. Avoid the common mistake of tilting your head back. While it might seem like a good idea, it can actually cause blood to run down your throat, leading to coughing or even choking. You can also apply a cold compress or ice pack to the bridge of your nose. The cold helps to constrict blood vessels, which can reduce bleeding. Once the bleeding has stopped, gently clean up any blood around your nose and mouth. Be careful not to disturb the clot that has formed. After a nosebleed, it's a good idea to take it easy for a while. Avoid strenuous activities and try to keep your head elevated. If you frequently experience nosebleeds, consider using a humidifier in your home. Dry air can irritate the nasal passages and make nosebleeds more likely. Staying hydrated is also important. Drinking plenty of water helps to keep the mucous membranes in your nose moist and less prone to bleeding. You can also use a saline nasal spray to keep your nasal passages moist. This can be especially helpful during the winter months when indoor air tends to be drier. If you have allergies, managing them can help reduce the frequency of nosebleeds. Allergies can cause inflammation and irritation in the nasal passages, making them more susceptible to bleeding. By following these tips and being prepared, you can effectively manage and prevent nosebleeds. Remember, staying calm and knowing what to do is your first line of defense. Stay calm, stay prepared, and you'll be able to handle nosebleeds with confidence and ease. While you're pinching your nose, you might be tempted to tilt your head back. It seems intuitive, right? Keep the blood from dripping down. But here's the thing. Leaning back can actually make things worse. It can cause blood to flow down the back of your throat, which can lead to an unpleasant taste, nausea, or even vomiting. Not exactly what we're going for. Instead, lean forward slightly. Think of it like you're about to tie your shoelaces. This allows the blood to drain out of your nose naturally, preventing it from going down the back of your throat. Plus, it just feels better than straining your neck backwards. Chapter 3. Cool it down. The power of cold compression. While you're maintaining that steady pressure on the bridge of your nose, let's add another layer of defense cold therapy. Grab an ice pack or a bag of frozen peas wrapped in a thin towel and gently apply it to the bridge of your nose. The cold temperature helps constrict those pesky blood vessels, slowing down the blood flow and encouraging clotting. Now, I know some people swear by putting ice directly on the skin, but I always recommend that thin barrier between the ice and your skin. It prevents any potential ice burns or discomfort, especially if you have sensitive skin. Chapter 4. Nasal spray, SOS, when you need a little extra help. So you've been pinching your nose, leaning forward, and applying a cold compress for a good 15 minutes, but the bleeding just won't quit. It's frustrating, isn't it? Nosebleeds can be quite stubborn, and sometimes the usual methods just don't seem to work. You might start to feel a bit anxious, wondering if there's anything else you can do to stop the bleeding. Don't worry, we've got one more trick up our sleeves: decongestant nasal sprays. These little bottles might just be the solution you're looking for. They are commonly used to relieve nasal congestion, but they have another fantastic use that not everyone knows about. You know, the kind you use for a stuffy nose? Yes, those same sprays can be incredibly effective when it comes to stopping a nosebleed. It's like having a secret weapon in your medicine cabinet. Well, they can also be lifesavers for nosebleeds. Imagine the relief you'll feel when the bleeding finally stops, and you can go about your day without worrying about it anymore. Look for sprays containing oxymetazoline. This is the key ingredient that makes all the difference. It's a powerful decongestant that works by narrowing the blood vessels in your nasal passages. This magical ingredient works wonders by constricting blood vessels in the nose, effectively putting the brakes on the blood flow. When the blood vessels constrict, it reduces the amount of blood that can flow through them, which helps to stop the bleeding. Just a couple of spritzes in the affected nostril can make a big difference. It's quick, easy, and can provide almost immediate relief. Make sure to follow the instructions on the package for the best results. However, it's important not to overuse these sprays. While they are effective, using them too frequently can lead to other issues, such as rebound congestion, where your nasal passages become even more congested once the spray wears off. Follow the instructions on the packaging, and if you have any underlying medical conditions, it's always best to check with your doctor first. Your doctor can provide personalized advice and ensure that using a nasal spray is safe for you. Remember, while nasal sprays can be very helpful, they should be used responsibly to avoid any potential side effects. So next time you find yourself dealing with a stubborn nosebleed, reach for that nasal spray and give it a try. It might just be the extra help you need. Chapter 5. When to seek medical attention. Recognizing the warning signs. In this chapter, we will delve into the critical moments when you should seek professional medical help for nosebleeds. Understanding these warning signs can make a significant difference in ensuring your health and safety. Now, it's important to remember that while these home remedies are super effective for most nosebleeds, there are times when you need to call in the professionals. Home remedies like pinching your nose, leaning forward, or applying an ice pack can often stop the bleeding. However, they are not foolproof solutions for every situation. If your nosebleed lasts for more than 20 minutes despite your best efforts, it's time to head to the emergency room or urgent care. Persistent bleeding can be a sign of a more serious issue that requires medical intervention. Don't wait too long, as prolonged blood loss can lead to other complications. Similarly, if the bleeding is heavy or gushing, don't hesitate to seek medical help. Heavy bleeding can be alarming and may indicate a more severe problem that needs immediate attention. Medical professionals have the tools and expertise to manage such situations effectively. Also, if your nosebleed is the result of an injury, like a blow to the face or a fall, it's crucial to get checked out by a doctor. Injuries can cause internal damage that isn't immediately visible. A medical examination can help identify any hidden issues and ensure proper treatment. There could be a more serious underlying issue, such as a fracture, that needs immediate attention. Fractures or other internal injuries can complicate a nosebleed and require specialized care. An X-ray or other imaging test can provide a clear picture of the extent of the injury. And lastly, if you experience frequent nosebleeds, like more than once a week, it's worth talking to your doctor to rule out any underlying medical conditions. Frequent nosebleeds can be a symptom of various health issues, such as high blood pressure, blood clotting disorders, or even certain types of cancers. Early diagnosis and treatment can prevent more serious health problems down the line. High blood pressure is one of the common causes of frequent nosebleeds. When your blood pressure is elevated, the blood vessels in your nose can become more prone to breaking, leading to nosebleeds. Regular monitoring and management of blood pressure can help reduce the frequency of nosebleeds. Blood clotting disorders are another potential cause. If your blood doesn't clot properly, even a minor nosebleed can become difficult to control. Medications and treatments are available to manage these conditions, so it's essential to consult with your healthcare provider. Nasal polyps or other growths in the nasal cavity can also lead to frequent nosebleeds. These growths can obstruct the nasal passages and make the blood vessels more susceptible to breaking. A thorough examination by an ENT specialist can help diagnose and treat these issues. Sometimes environmental factors like dry air can contribute to nosebleeds. Using a humidifier in your home can help keep the nasal passages moist and reduce the likelihood of nosebleeds. Staying hydrated and using saline nasal sprays can also be beneficial. Allergies can also play a role in causing nosebleeds. Frequent sneezing and nasal irritation can weaken the blood vessels in your nose. Managing your allergies with appropriate medications and avoiding triggers can help minimize the occurrence of nosebleeds. If you have a family history of frequent nosebleeds, it's important to be extra vigilant. Genetic factors can influence your susceptibility to nosebleeds. Discussing your family medical history with your doctor can provide valuable insights and help in creating a personalized care plan. Practicing good nasal hygiene is another crucial aspect of preventing nosebleeds. Avoid picking your nose or inserting objects into your nasal passages. Gentle cleaning and proper care can go a long way in maintaining the health of your nasal tissues. A balanced diet rich in vitamins and minerals can also support the health of your blood vessels. Nutrients like vitamin C and iron play a vital role in maintaining the integrity of your blood vessels and preventing nosebleeds. Consulting with a nutritionist can help you create a diet plan that supports your overall health. Stress management is another important factor. High stress levels can contribute to elevated blood pressure and increase the risk of nosebleeds. Incorporating stress-reducing activities like yoga, meditation, or deep breathing exercises into your routine can have a positive impact on your overall well-being. Regular follow-ups with your doctor are essential, especially if you have a history of frequent nosebleeds. Keeping your healthcare provider informed about any changes in your condition can help in timely diagnosis and treatment of any underlying issues. Remember, seeking medical attention when necessary is a proactive step towards maintaining your health. Don't hesitate to reach out to your healthcare provider if you have any concerns about your nosebleeds. Early intervention can make a significant difference in managing your condition effectively. By recognizing the warning signs and taking appropriate action, you can ensure that your nosebleeds are managed safely and effectively. Stay informed, stay proactive, and take charge of your health. Outright, you've got this managing nosebleeds like a pro. So there you have it, your comprehensive guide to stopping nosebleeds in their tracks. Remember, most nosebleeds are nothing to worry about and can be easily managed with the simple techniques we've covered today. Just stay calm, follow these steps, and you'll be back to your normal self in no time. Thanks for watching. If you found this video helpful, don't forget to give it a big thumbs up and subscribe to our channel for more informative health tips. And as always, if you have any concerns or questions, don't hesitate to reach out to a healthcare professional. Stay healthy, everyone.